That's everyone's favorite part. It's not so bad, guys. We're going to break it down. Let's start with one that we should all be very familiar with, that being HIPAA. Please know what HIPAA stands for. Not just HIPPO. It's not HIPPO. It stands for the Health Insurance Portability and Accountability Act, and that's basically patient confidentiality as far as medical records go. So all medical records and other individual identifiable health info, that being electronic, paper, and oral information, are covered by HIPAA legislation. In other words, if I leave a computer open with an image in the public view, is that a HIPAA violation?
Yes, sir.
Yes, it is. If I have an order for an x-ray, I don't shred it, I fold it up, put it in my pocket, and I put it on the table while I'm eating lunch. Have I committed a HIPAA violation?
Yes, sir.
Yes, I have. If I'm at that said lunch and I'm talking to my fellow classmates about how awesome that fracture was on John Smith, where people can hear me, is that a HIPAA violation? Yes, it is. So that's what I mean by electronic, paper, and oral. Yes.
Orally, we are allowed to omit the patient's name and other identification, but still
That's where it
talk
gets a
about
little
them.
gray. Technically, as a professional, you shouldn't be discussing anything in public. Even if it's something really cool and you make up names, technically speaking and legally speaking, you should not be doing that. I know everybody does, but as far as what they would ask you on a test, let's go with what the curriculum says. I should not discuss anything, period. Period. Outside of the department. Make sense?
Mm-hmm.
Remember, I don't want you to focus on what you see in clinic. I want you to focus on what the curriculum says. And that's one of the biggest hurdles we're going to face moving forward, especially when we start reviewing positioning again, because a lot of you learn positioning from me, Mr. Fung, and Ms. Bonilla, but very quickly, you kind of learn how techs do it differently. And you can sit there and be thinking all day long about how this super tech did it this way, but does that make it the right answer on the test? It does not, because the test is going to reflect what, guys? The curriculum. So we've got to get back to what the curriculum says on all aspects, all points. Make sense?
Yeah.
Yes. All right. Patients. It is required. All patients must be provided with confidentiality and privacy. All patients of every type, every place in the world are covered by the HIPAA Act. All patients also have the right to be informed, to make informed consent, and also to refuse treatment. Gold star on all these bullet points here, guys. All gold star questions. Once more, all patients have the right to be informed. They can ask about their exam, to make that informed consent, to make their own decisions, and the right to refuse an exam no matter what it is. You can't pressure somebody into an x-ray no matter what you say. If they say no, they have that right to say no. Now we have things like implied consent. When would something like implied consent?
When they're
Apply.
unconscious.
The patient is not able to do it himself.
Let's say you come in from a car wreck and you're all busted up. Can you make your own consent? You cannot. You have no family around. What's going to happen? The officials at the hospital are going to try to make the best decision for you as a patient. That would be that implied consent. Yes.
I think there, as of late, is like a feature on most smartphones where you can have DNR and your medical
You can,
records.
yes.
So
Yes.
would they check that first before, trying?
They could. A lot of times it's on people's driver's licenses. If none of that's available, they're still going to make that best decision based on what info they have. Yes. Now, if you do arrive in a trauma room, let's say Jay, you arrive on a stretcher and you're busted up from a wreck. You're passed out. You're old enough to make your own decision, but let's say mom or dad was with you and they show up with you. Does mom and dad have the right to make that decision for Jay if he's passed out? Yes, they do. But if mom and dad are not present, or family is not present, then the hospital makes that decision. You'll see how it works, the chain of command there? Making sense? Those are all great test questions right there of the types of consent we could give and the rights of the patient.
And when the hospital makes a decision, so it becomes implied consent.
It becomes a what?
Implied consent.
Yes. Yes. Are we on this slide or are we still writing? We good? All right, speaking about consent. Consent can be in a verbal format. It can also be written, where they sign off on the paperwork, as most of you have seen. And of course, there's that implied consent once again. Written patient consent is required for any examination. It's important to write down. Any exam that involves a greater than usual risk. What would that be? Things like our invasive procedures, like surgical procedures, things that require contrast. Why would contrast be a greater than usual risk?
Sometimes
Allergies. Allergies, right? You may not know you have a contrast allergy. It might be your first time, and they won't know until they actually inject the contrast. So that would be a greater than usual risk. All of those, once again, please write that down, must be in a written format. You cannot give consent for these type of exams orally. It must be written down and have actual signatures on it. Our lower risk procedures, consent given on admission would be sufficient. So if someone just coming in for a chest x-ray, you just get that oral consent, we're gonna send you for a chest x-ray, okay, I'm fine with that. Making sense?
So, one question. Do you need a witness for a verbal?
For a verbal consent, do you need a witness? Not necessarily, no.
So what if later they go, I didn't consent to it, you have no proof?
What if what now?
Later they say, oh, I didn't consent to.
That's why they have it all documented in the system, the oral consent. They cover their bases on that. Because I'm sure people try to say stuff like that. Conditions for valid patient consent. Big star on that because this comes in the form of many multi-answer questions right here. A patient must be of legal age, which would be what?
18
18 and up. They must be of sound mind. What would not count as sound mind?
Mental patient.
A what?
AMS.
Mental patient.
AMS?
AMS.
What else?
What's the
Maybe someone who is a special needs patient, be an example. How about a baby? Is a baby, well, I mean, that's below the age too, but baby's not sound mind to make a decision. They can't make a decision. What about a elderly person who has extreme Alzheimer's? Would that be sound mind?
No.
It would not. So you can see there's many examples of that. So sound mind must be present for valid consent. A patient must give consent freely. What's that referring to?
Without
You can't
under
force
force.
them. You
Without
can't,
coercion.
you can't manipulate somebody into an exam or pressure them into an exam. They can sue you for that. Patient must be adequately informed of procedure about to take place. What's that referring to? Should be common sense?
Knowledge of it. No, you should have the knowledge of what's happening.
I mean, they can't give a consent if they're not informed what's going to happen.
Exactly. They can hold that against you as an x-ray tech, guys. You go, that's why I always say it's important that you always describe what you're doing for the exam. Don't just have someone come in for a chest x-ray, say, hi, I'm John, go stand over here. All right, don't move. B, all right, turn. Don't move. Hold your breath. B, all right, have a nice day. How can I get in big trouble for that? Did I explain anything I was doing? Why would I be liable? What's that have to do with anything? Why should I let them know? Because I have to describe what I'm doing for a procedure. I can't just go jab a needle in someone's vein without telling them, right? Why we're doing it and what's happening. No, I'm sure we've had people do that stuff before. But legally speaking, and per the curriculum, we have to always tell everyone everything we're doing, no matter what the procedure is. You have to thoroughly explain that procedure. That's part of the consent process. Otherwise, they can claim that they were not properly informed and sue the hospital. You can also lose your license or something like that if it got to be bad enough. So you always explain everything you're doing, guys.
And also, like, while you're explaining, they might be like, oh, wait, I don't have pain here, it's over here.
Exactly. That's how we avoid things like x-raying the wrong parts. How many times have y'all seen the wrong part ordered? Have y'all seen that
Enough.
more often?
Yeah.
It happens a
Enough.
lot.
Yes.
If I slap them on the table and just start taking x-rays, and I x-ray the wrong part, is it the doctor's fault to order it, or is it me, the tech's fault? It's actually the tech's fault. The doctor's not gonna take responsibility. Now, if I call them out on it before I do it, then it's the doctor's fault. But if I didn't pay attention to the details and check on it myself, it falls under my liability. Make sense? And we don't wanna overexpose the patients, we don't wanna x-ray the wrong parts. That's a very quick way to lose your license as well. X-raying the wrong parts, it's a big no-no. Even if it's not directly your fault and they misordered it and you missed that, you've got to pay attention to those details.
This isn't like super important, but I was just curious if there isn't exactly like radiation involved in like other things such as like MRI or whatever. It's not as big of a deal, is it, whenever you do the wrong?
Oh, it is, because they still try to bill the patient of all that stuff. And I don't know if you've seen a bill for an MRI, it's not pretty.
Cause I seen it do a wrong thing frequently.
They should be paying more attention because that's a big deal. So this is where, I'm gonna go off on a tangent here, this is where the hospital corporations get very crooked. You can do the wrong exam. Let's say they were there for a chest MRI and they do the head. They do the head, they realize halfway through, oh my God, it's just your chest. So I gotta tell the patient, oh, we're gonna do your chest too. That's how long we'll play it off. But guess what the hospital system's still gonna do?
Yeah,
They're gonna bill them for both those exams.
which is why they always.
And they're not gonna explain why either. They're just gonna take the text word like, oh, da-da-da, they need both, whatever. That's more money for them. They're crooked like that. But is that ethically right? Is that morally right? It is not. Because like I said, I don't know if you've seen a bill for a CT or MRI, it's not pretty. And that poor patient's gonna pay that off and know it was unnecessary.
They act like it's not a big deal though.
They should act like it's a big deal as it is. But some people have no morals, what can I say? Some people have no ethics. You should do the right thing, though.
If all those patients pay for
Now, what they should do, if you want to start writing this down while I talk, is the patient bill of rights. What they should do when that occurs is own up to it. Hey, I did the wrong exam. Let's not charge them for that exam. I'm going to correct that and do the right one. You own up to something, you're going to get in less trouble anyway. Because if they follow up later, let's say the patient got wise to it and said, hey, they did an MRI of my head for no reason. They follow up on that, and you would explain that that was for a reason. That's going to be a big mess on your plate because you're going to have to stand up and defend that. You might lose your licensure. All kinds of stuff can happen. Honesty is always the best policy because we're human and we make mistakes. I've x-rayed wrong parts before. Everyone will. It's better to own up to it than try to hide it. Because I've seen people try to hide it and lose their jobs versus people that own up to it and it's just fine. Just trust me on that. Trust me on that. People, especially these days, because everything has a paper trail, people are going to find out if you're hiding something quickly. Patient Bill of Rights. This is a lot, but you need to know all these guys. Another example of a multi-answer question where we list things, do these fall under the Patient Bill of Rights? Considerate respectful care, common sense. Inform completely and understandably as far as consent goes, or we explain the procedure. Right to refuse treatment. Have an advance directive, things like a living will. Privacy, which falls under HIPAA. Confidentiality, which also falls under HIPAA. They have the right to review their records. Yes, they do. A lot of people, for some reason, always miss that one. Patients have the right to review their records. They can request appropriate and medically indicated care and services.
Thank you.
They have the right to know about institutional business relationships, be informed of, consent to, or decline participation of all studies, like we just stated, the continuity of care, and to be informed of all hospital policies and procedures. These are all the rights of a patient when they go into a hospital. You have to know all those guys, or be able to recognize them and pick them out in a multi-answer question. My 90s peeps, y'all remember this?
Yes.
I'm just a bill sitting on Capitol Hill.
Oh, wow.
That's
Schoolhouse Rock.
You did that.
When you say review their records, is that like requesting their records?
Yes.
Like from the medical
We check for
records?
accuracy and things, yeah.
Not like looking at the picture right after we take it.
No.
Okay, because they do
They
that
can come
outpatient.
back, they can come back and request those images.
They do that outpatient.
They can't, so when you see people doing that, I know you're following the tech, but the tech should be chasing them out of there. No, you cannot do that. I used to get mad, I used to almost get in fights with some parents. Those parents be trying to sneak around that corner, I'm like, don't, I'm like, no, you go back around that corner, you can't come back here.
They have to like officially.
You have to get kind of stern with
their
them.
record.
Sorry, mom and dad, you cannot come back
So
here.
they'll
I
have to
cannot
see
tell
it
you
in
anything.
outpatient.
They get bold, they get really bold trying to sneak around that corner.
To try and take a picture.
And then
of
they.
Or
the-
just a
ask
look.
questions
Wait, they
like,
can't
"Oh,
even
yeah, I
look?
can't tell
They
you."
can't look at the.
They cannot
X-ray
look
their
at,
own
they
anatomy?
cannot look at films after you take an x-ray.
Really?
Well, we're not doing
I
film.
know, you see,
Yeah,
I know you see text letting people look at pictures, they should not be doing that. It's a huge HIPAA violation.
So doesn't that?
Now, why is that important? Because you might have other patient stuff pulled up behind there that they're gonna see. You don't know what you have at that control. You might have other orders sitting there and they say, hey, that's my best friend, they're getting an x-ray today too. All of a sudden, you got a huge HIPAA violation, confidentiality break. They cannot come around that corner, they cannot visualize their images after you take them. They can request copies after the procedure. That might be a test question too, by the way. Does that make sense? You can request images after, you cannot look at images as they have been taken. We clear on that? And I want y'all to please make note of that, because I know you're seeing things in the hospital that aren't correct. We gotta go with what the curriculum states, what the law states. 'Cause that's what they're gonna ask you on your registry.
It says know about the institutional business relationships. The benefits of treatment and care.
Basically what the affiliations are with the hospital. Like who are they paired up with? Are they paired up with Baylor College of Medicine, this, that, and the other? All those, I don't know why anybody would wanna know that, but they have the right to know it. So, yeah. Some people are very thorough. Well, they're affiliated with the Baylor College of Medicine. I'm going there. Probably heard people say something like that.
About, do they have the right to like record you?
To record you? They should not be
You know how
recording.
these days people record everything, so
They should not be recording anything in the room, no.
in the room,
I don't know what the actual
lawyers.
law is on that, but I'm not letting anybody record me in the room. No. Put that away.
But I have seen them
Oh,
take
I've
pictures.
done it
like in therapy.
like a voice memo, so that I can relay to my mom or something after.
But don't you need a consent?
That one I'm not sure about, John's, because with the availability of all the smartphones, I'm not
Right.
sure what the actual law is on that. It might be
Heard-
allowable. I don't like people recording in the room, though.
If it's a public place, they can record. So I guess depends.
I mean, I'm sure it happens a lot. Everything has recorders on it these days.
Reporters, picture taking.
If
I
they
think
come
as long
in
as they're
with a
not recording
GoPro,
the actual
Procedure
images,
and- Oh, images.
I guess.
Well, the
I'd have to look
procedure is
into that. I'm
also
not sure.
public.
I'm not exactly
Huh?
sure.
The procedure itself is also public information. It's like people going on flights and recording.
Okay, guys, some more laws, legal issues. Please make note, the ASRT is what publishes what we call our practice standards within radiography. All of our practice standards fall under the ASRT, which stands for what? Not a trick question, it's right there. Please know that they publish the practice standards and they also publish our curriculum. Please write that down because people mix that up with the ARRT. The ARRT publishes what?
The exam.
The exam and the content specifications of the exam. They're also the ones that give you your licensure. So let's say that again. ASRT publishes our practice standards and our curriculum we base our schools around. ARRT administers the board exam, which is the registry, publishes the content specifications found on the exam, and also grants you your licensures. You do not get licensed through ASRT, you get licensed through ARRT. When you take your registry, ARRT is the one that gives that exam. I know it's very confusing. I wish they'd merge both bodies personally. But-
Certification.
Hmm?
We got stuck on that.
Certification.
Certification.
licensure is
Licensure, same thing. Certification, licensure, that comes from ARRT.
Don't we get licensure from like this particular state?
You get a state licensure, you also get licensed nationally. Yes. You need two licensures. You need a national license, which is your ARRT, and you need a state license. Here would be the TLB. Yeah, two
And you
things.
have to apply to those at different times, right? Like one.
We're gonna apply for them next year,
Okay.
all together. You get to
Okay.
pre-apply as students.
Oh, okay.
I'll walk you through all that. Question?
Yes, Mr. Donahue, the ART's responsibility is licensure and what else?
Also, they administer the registry exam, and they publish the content specifications found on the exam. Now, there's
For the
one more.
registry exam, sir.
Sorry?
The content for the registry exam.
Yes. Now, there's one more organization, the JRCERT, JCERT. What are they responsible for? Accreditation. Accreditation, that's all you need to know for JCERT. They're responsible for accreditation, which I'm working with them right now, doing what's called a self-study that's due on July 3rd to keep our school accredited. I'm at 53 pages on that thing. Yeah, it's a nightmare.
Appreciate you.
It's a nightmare, but it's almost done. Now, talking about ASRT again, guys. These standards that we use in radiography, they are what we use to define and identify clinical, quality and professional standards of practice. Once again, that's through the ASRT. If you ever see the word statutory law, we're going to go over some definitions here. Statutory law refers to laws enacted by congressional, state, or local legislative bodies. Please know that definition. Two kinds of law. We have private civil and we have public law. Private civil includes laws that regulate relationships among people, while public is the relationship between individuals and the government. Please know the difference between those as well. Private civil is between people, public is between people and the government. It's from Judge Dredd. That's an old movie when I was younger. Sylvester Stallone. Yeah, he's getting on up there.
He's what, 60 now?
He's in his 70s.
70. Wow.
Does he have like a lot of Botox or something?
He's had a lot of plastic surgery. He looks like he's made of plastic.
Who
Huh?
was that just had that baby?
Gosh.
80 some years
Oh,
old?
that's
Who's that?
Arnold Schwarzenegger?
No,
Al
Arnold
Pacino.
Pacino.
Robert De Niro. Oh, and Robert De Niro, yeah.
I saw.
Scarface. I thought y'all know that movie.
They gonna be like 100 when the baby been 20.
Hey.
All right. More definitions, guys.
Can you go back one more second?
Oh, yes. A lot of these are going to be basically definitions. Once again, what do I keep saying is the key to your success in the registry? Understanding your key terms. A lot of the stuff we're reviewing is going to fall under what we call key terms. You'll see it used in a question. You've got to identify that term and know what it is to answer the question. Does that make sense? So here's some more great ones here, guys. We're going to go over a few of these in more detail, especially that assault versus battery. False imprisonment. You hold somebody against their will. Kind of self-explanatory. What's an example of false imprisonment?
Y'all holding me here?
Strapping them down.
Strapping them down without their consent.
Well, I've seen that.
You should not be seeing that.
I've seen it. Okay, so give me some context on that.
If I have a special needs patient
Mm-hmm.
that is autistic,
Mm-hmm.
I'm going to use an example I see all the time. This autistic patient's flailing their arms around, very aggressive,
Mm-hmm.
and the nurse has had enough, so she just ties his arms down.
Okay.
Mom and dad's not around, she just does it herself.
Okay.
So she does it, mom and dad comes in and says, "What are you doing?
Mm-hmm.
I did not give you permission to do so." That would fall under false imprisonment.
Okay.
That's a lawsuit right there.
What about a homeless patient?
Yeah,
Can you
what?
grab?
Doctor's order to do
You
that.
have to, a doctor's
It's
order to
only
do
good
that,
for
yes.
24 hours.
Yes.
Can you do it to a homeless patient?
To a what?
Homeless patient.
They have the right to refuse. It doesn't matter what kind of patient they are.
What about prisoners?
Prisoners fall under a different thing. They've already broken the law. So.
They're already restrained, hopefully.
All right. Assault versus battery. Guys, you have got to understand that there's these two. You will have these on your tests, almost every test, including your registry. What is assault? The threat or the verbal exclamation of harm. "I'm gonna smack you if you don't shut up," is assault.
I've been assaulted.
Now, how many people use that term incorrectly? Because you see it on TV all the time. Like you see someone get pushed. "He assaulted me." Actually, no. If I push somebody, I'm using battery, not assault. Assault, you do not touch anybody. You literally vocally threaten somebody. If you don't hold still, this needle is really gonna hurt. That's assault. If you don't stop kicking, this X-ray is gonna take 5 hours. That's assault. That's assault. That's assault. You're threatening a longer exam because you're angry and irritated. Yes?
So you can get fired for assaulting
Yes, you
someone?
can. You
So
can get
how
sued
come-
for that.
How come Tim didn't get fired?
Thank you.
Because no one turned him in.
What?
Or the patient didn't say anything. I don't know.
Well, he said he was gonna
Is
strike
it
you,
what?
right? So how come he didn't get
That
fired?
is assault. Oh, I'm thinking of something. I thought you were talking about the patient. Did you report it to management already? No?
Yes.
That falls on management doing what they're supposed to be doing. That's what it comes down
they
to.
didn't do
They
it.
said,
So
I'm sorry.
So-
there's the unfortunate thing.
I'll take that take over you.
It depends on what management's gonna do.
Yeah, I know we
And-
short-handed.
He came up to me and they like pretty much forced him to make an apology, but that was it.
That's where, I'm not gonna say too
So,
much.
but
That's
like-
where the importance of
recorded,
good
so-
management comes into play.
I've got a lawyer. I've got a lawyer. I just like.
All right,
I-
simmer down, simmer down.
But anyway, let's get back on track. Battery. Battery means you physically have touched somebody without their permission. Does not mean you go and punch somebody in the nose, although that would be considered battery. If I walk up to Angelica, I'm like, hey Angelica, I want you to come this way with me. We're gonna walk over the x-ray and we're gonna do a chest x-ray. And Angela's like, what are you touching me for? I don't want you touching me. I just committed battery because I touched her without her consent. Even though I was good-natured, I was trying to direct her this way. Technically, she did not want me touching her. She did not give me permission to touch her. I committed battery just now.
How is that a threat, sir?
How's that one?
Carrying out the threat.
We're not talking about
battery.
threats, no, we're talking about battery.
Battery. that
Battery is the physical touch without someone's permission. Now, there's a lot of areas this can fall under because a lot of people say, well, battery is just when I go and hit somebody, I pinch them, I stick them. No, it falls under many different examples I want you to keep in mind because they can give you many different forms of this question.
Spitting on somebody's battery.
Huh?
Spitting on someone's battery, if y'all didn't know.
Because the spit actually makes contact, yes. What's an example a lot of people don't realize? Let's say I go into an x-ray room, or let's say I go into a portable exam with a portable machine, and I do a chest x-ray without an order. Which does that fall under, assault or battery?
One more time.
I'm being very vague on intention because this is where critical thinking comes into play.
Wait,
I walk into a patient's room to do a mobile chest x-ray. I do not have an order, but I do the x-ray anyway. Is that assault or battery?
Wouldn't it be? It's just negligence.
Yeah, like no.
It would be battery because what do I have to do the chest x-ray? I have to touch the patient, move them forward, place the board behind them, and so on. I did it without, even though it wasn't without the patient's permission, it was without the hospital's permission. Because I did not have an order. Your order is your permission to do an exam. Y'all see how I did that? Y'all see where the critical thinking comes into play there? That is a registry question, ladies and gentlemen, that I just gave you. Yes, it is. That's how sneaky they can get with these terms. So you've got to think beyond just the definition and apply it to a real scenario. Now, if I go into that same room, and let's say I have my order to do my chest x-ray, and the patient's going all crazy. I'm like, you need to sit still or I'm gonna call a nurse to restrain you. What did I just commit now? Assault. Do you see the difference? Now, I'll get y'all's questions in just a second. One way I remember assault versus battery, and this might be the most, not must be the most appropriate way to remember it, but assault, when you say something stupid, you make an ass of yourself. It's in the word. When you commit battery, I think it's hitting someone with a bat. Saying something versus touching.
So ask you.
There you go. There you go. I saw a bunch of hands go up though. Who was first?
I have a question. I thought earlier you said like when you x-ray the wrong patient or part, I thought that was battery too.
Say again?
I thought earlier when you said you x-ray the wrong patient or the part, that's battery too.
It is.
Then when you have it on the
There's overlap.
Okay.
You can
okay.
commit multiple torts, not just
Okay.
one. They can fall under multiple categories. Keep that in mind.
so to sue you for more
You're
than one
touching a
thing.
part when
Yeah.
you're not supposed to touch the part, but you failed to look at the order or you
That would be
failed to ask
battery
them.
because you touch.
Yeah, but then you also failed to ask about
Yeah, that's what I'm
what's.
saying, but you have it
Correct.
So
you have overlap.
Negligence.
Now, keep in mind, even though there's overlap, they're not going to be so cruel to put all those as answer choices. There'll be one clear answer choice. They'll either have something like battery or negligence or so on and so forth. Make sense? They're not going to have like all these answer choices and it fits into 4 of them. No one could answer that. That wouldn't be fair. Emily, you raised your hand.
So would verbal fall under assault and battery? Like, can you verbally batter?
You cannot.
So that
Does
will-
verbal? Does anything verbal touch somebody?
It would hurt my feelings.
But is it physically touching you?
No.
So it would not fall under battery.
Okay.
Very important to remember that. Battery has to involve physical touch. Assault will only be verbal. Or I guess it could be a written threat as well. Like I slip you a note, like if you don't shut up in class, I'm gonna knock you out. Slip this over to John. It's like, quit asking so many questions, John, or I'm giving you a 0 on your test. That would be assault. It's a threat, even though it was written. But y'all get what I'm saying, yes?
There's no self-defense in any of this. Like you can't, you know what I'm saying? Like, cause you know sometimes those patients there's psych patients and stuff like that. So if they batter you first.
You can defend yourself, but don't turn back around and like kick them in the head or anything. You know, use your best judgment. You gotta be a professional.
And you just got that jaw replaced.
You're like, no, oh no, you didn't. Like kick them in the head. You know, like, no.
So I mean, if a patient starts like just like trying to grope on you, you push them back, like, what you doing?
Well, you have the right to do that. Absolutely. They touched you first. They're battering you. Don't let them batter you. Someone's being inappropriate. Absolutely. Yeah, that's not. Yeah. Use common sense. Yes.
They about to get they sense knocked out of you.
Okay, but let's move on. Yes.
So, I had 2 questions. If a patient assaults you by whatever threat, let's say they threaten to kill you or whatever, are you able to just dip from that exam and say, unable to complete exam?
You have the right to make that decision, yes.
Next question. If we were to avoid the threat to harm, instead of saying like, I'm going to call the nurse to restrain you, you say, I'm going to call the nurse so that we can complete the exam.
That would be more appropriate, yes. That would not be a threat.
Okay.
So there are ways you can express things without a threatening manner. Keep it professional. Good example. Very good example. Let's go through the rest of these guys. Defamation. What is defamation? That's the disclosure of confidential info to unauthorized people that is detrimental to the patient, causing ridicule or loss of job. So
That involved with HIPAA?
basically blackmailing somebody with private info. Like I just found out my best friend has cancer. I'm gonna use that to blackmail them. I'm gonna disclose some confidential info. That's defamation. Invasion of privacy. That's the disclosure. That does not mean you walk in on somebody changing, which a lot of people for some reason always think that's what that means. I've had that in previous classes. That's the disclosure of confidential information to unauthorized individuals. Now, very close to defamation, they do overlap with each other. They basically mean the same thing. They both can be considered the same thing, essentially. I don't want y'all to get confused on that. Defamation, invasion of privacy, both overlap. Okay? Yes?
But the invasion of privacy, wouldn't that be HIPAA?
Yeah, because you're disclosing confidential info. It's a HIPAA violation, but it also is a tort.
Okay.
See, it's an intentional tort or misconduct. Negligence. Also, things like x-raying the wrong patient parts could be battery and negligence. See the overlap there? Also, what else could be negligence? Let's say I have a toddler on the table, parents aren't with the patient, I walk away to take my x-ray and the toddler rolls off the table. That would be negligence. Does it make sense?
And malpractice.
And malpractice, thank you. There's a lot of overlap on these. So, anything that's falling under the category of a fall, positioning injury. Let's say they have a broken arm and you break it further because you're being rough with positioning. That's a malpractice suit. Pregnancy on a patient, like taking an x-ray on a pregnant patient without getting their consent and or discussing it with the radiologist. That is a malpractice suit. Errors or delays in diagnosis, of which doctors have malpractice suits all the time. If you ever saw the amount of malpractice suits that occur daily, it'd probably make you faint. There are a lot of errors amongst physicians. Misdiagnoses, reading x-rays wrong. I would not want to be a physician. I don't care what you pay me. It's a lot of stress.
We have to go to court.
But that all falls under malpractice.
So is that even if they, do it in good faith or like it was a simple mistake?
It's still a malpractice.
It ends up in like harming the patient or whatever?
Mhm.
That's right.
Like I see a nodule on a bone and say it's cancer when it was actually a fracture. And that patient's been undergoing chemo for 5 months. Then they find out, oh, it was only a fracture. I mean, that patient has the right to sue the crud out of that hospital. And I hope they would, because that's a lot of cost to them, their insurance, and unnecessary chemo treatment.
Right.
And believe it or not, this stuff happens a lot. Doctors, they're humans. They make mistakes. Just like we're all humans here, we make mistakes. Happens quite a bit. But hospitals have like what they call a slush fund. You ever heard of a slush fund? Politicians use it all the time.
That money put aside.
Money put aside to shut people up and pay them off. That's what politicians do to get away with the crap they do.
And insurances don't.
Slush
like
funds.
that. So they will fight with you and for you so that they can get their money back, because the insurance company does not want you.
It's hush money. Hush money. Slush fund, hush money. Hospitals, they have tons of it because this stuff happens so often. Like, oh, you know what? I know it's bad, but here's $500,000. Let's just keep it quiet.
It's not enough.
Didn't you say that in Texas Children's Hospital, someone amputated the wrong leg?
Yes, they did.
And they had to cut amputate
They had to amputate both legs.
So that was malpractice.
That was a huge
That's
malpractice,
a lot of different
yes.
stuff.
And that poor patient, his whole life is ruined. 'Cause he's lost both legs. I mean, I don't care what you pay that family, it's not gonna fix the amputated legs. Yeah, yeah. Scary stuff.
It is, and you just make it scary every time you say something.
I've seen a lot, unfortunately. Okay, a little bit more about our other legal aspects, guys. Now, all radiologic examinations, they can only, despite what you see in the hospital, our rad examinations can only be requested by a physician or a PA. Physician and assistant, those are the only two people that can request examinations. Physicians and PA, not nurses. And how many nurses try to request exams for you? Or from you? Oh, can you do this? I'll have the doctor put it in later. Have you ever heard that?
Yesterday.
Technically, legally, they cannot do that. I know it happens all the time, but legally, the doctor or the PA are the ones that are supposed to request that, not the nurse on their power trips that they get. They cannot legally do that.
And then they come over and look something with
Oh, I know, it's so irritating, isn't it?
Take a picture.
Like, go
and
sit
run
down.
away.
Go sit down.
That's what nurse practitioner.
That's what a PA is. That falls under PA. Good question, though.
What was your question?
Nurse practitioners fall under PAs.
Practitioners.
Yes. All right, most our facilities require an examination request to include what we call pertinent information and any infection control or isolation information. In other words, all orders that come through for x-rays must have pertinent info. They need to have specifics of why the exam is being ordered. If the patient has any kind of infectious organisms you need to be aware about, and also if they're under isolation. That could be a legal thing that you as a professional could sue the hospital for if they're not providing you proper information.
Right, 'cause
Let's say you get infected with something and they didn't specify it on the order, you have the right to file a legal case on that because you got infected, they did not properly inform you as a technologist.
So like if a patient has HIV.
If they have HIV and it's not in the chart, not on the order, and you get exposed, you have the right to sue that hospital because they must require
Even
that
if they don't know
information.
for sure and they suspect that's what being tested for, they need to put that on the board.
Yeah, suspicion of HIV, that would be something.
But is that against the hospital or against the patient then? Because if the patient
I think it's the hospital.
So even if the patient's like I'm just not gonna tell them that, like.
It's still against the
They're
hospital.
supposed to know, they're supposed to check into the
Yeah.
details.
Our ASRT practice standards, they identify the level of knowledge and skill required for you all to be professional radiographers. They're the ones that actually identify that knowledge and skill that you're acquiring right now. That's why they publish the curriculum. ART, their code of ethics, details the guidelines for your professional conduct. The rules of ethics are mandatory and enforceable. So why are we so hard on y'all in clinic and in class for professionalism? Because the ART requires us to do so. For you to be licensed. We have to check off that, hey, Charo, she's got good ethics and professionalism. She can get out there and be a professional x-ray tech.
I'm so glad y'all hard on us, it's boy.
Have to be.
Yeah, because when you go in clinic, boy.
Plus, when y'all get out there to other hospitals, because not all y'all are going to work Harris Health, I want y'all to be representing us good. Like, I want them to say those Harris Health people are the best employees we ever hired. I want more of those. Like those people from HCC, those people from San Jack, they're terrible.
Appreciate
Those
that.
MD Anderson students are awful, but those Harris Health people, man, they got it going on,
I've actually heard
which I've heard as well.
students from here.
Now, I've worked with students from other schools and they're trash.
Bring it up.
It's
Bring it
not
up.
the language of the people.
They are. I'm not just saying that. Like I worked with 4 different schools at Texas Children's and they were horrible. Horrible. I was not impressed. But the ones from here,
It's because like they didn't know how to work with children or just they suck.
they just were terrible. They didn't care, they had attitudes, they didn't know what they were doing. I was not impressed.
I don't know what the fault of those people got here about Harris.
All right, we good on this page? Good to move on?
What if the hospital doesn't provide their proper PPE for, let's say, a highly infectious patient?
Then you could sue the hospital for that. That should
Still?
always be available to you as a worker.
Okay.
Some more definitions, guys. I want you to write down or take a picture of that, some that you might see interchangeably in questions. You may not have had this in class, but these are some that pop up. What is beneficence? That's simply bring about good. Beneficence sounds like what? Benefits. Like a benefit, something good. You perform actions that benefit others, decide to act always to benefit the patient. That's practicing beneficence. Huh? There you go, that's being beneficent. Non-maleficence, preventing harm. Above all else, that's something we practice. We do everything without harm or as little harm as possible. That's non-maleficence. Autonomy, sounds like what? Automatic. That means acting with personal self-reliance, almost like you're in autopilot mode. Perform actions that respect the independence of other persons. Patient must decide what is done to his or her person. Veracity, telling the truth. You said that statement with much veracity. Use that next time around the Thanksgiving table. You're talking with such veracity today. Being truthful, simply, just telling the truth. Fidelity, being faithful. Performing, like non-fidelity. Non-fidelity is non-faithful. You hear that with all the divorce cases. Lack of fidelity. Performing acts that observe covenants or promises is right, be faithful. And then justice, acting with fairness and equality. Performing acts that ensure fair distribution of good and harms are right, always be fair. Good definitions to know if you see these used interchangeably in questions, guys. Please take a picture of those, write those down, because I'm not sure these were in your text, but I've seen them come up in questions.
Can you take one more step back, please?
Dang.
No, he's
No,
like,
no,
step
no.
back so you can take
Your
a
hand was
picture.
on.
Oh, my head. Just tell me to get out the way, Johns. I won't take offense.
My dad is bald, so he calls his head his hubba. His hubba. My dad, move the hubba.
You making fun of my hair now? Is this what's...
Take it as you will.
Y'all are on it today.
You guys, been irritating. My hair's been going lighter for some reason.
It's hot.
And it's making me look balder. I don't like it.
Well, like the summer, like make people's hair lighter. Get you a little bit of just for men.
I'll bring you some tracks.
Some cracks.
Some tracks.
Oh, tracks.
We're gonna glue it right here so you can be like,
I'll get you be full.
You know
Thank
what
you.
it
I
is?
appreciate it.
Just a
I appreciate
two-page
it.
tracks, Mr. Donahue.
Huh?
A two-page tracks. I'm just going to
I
change
think
terminology.
before I do a toupee, I'll probably do the implants.
No.
Which my cousin had that done. It actually was pretty spectacular, I gotta
looks
say.
good.
I couldn't
Yeah,
tell.
it do.
I heard it hurts like a ridiculous amount.
Oh man, it looked good though.
Good.
It looked good on him. I was like, man, you can't even tell.
he's like, I'm gonna sit through that pain.
It's worse than a tattoo.
Well, they like literally like implant little follicles in there.
All right, speaking of
Yeah.
torts, what is a tort? I always think of
Wrongful
tater
act
tots
or
when I see that word.
infringement
Makes me think of
of
tater
rights.
tots.
Talking about a tort?
A tort. That's a wrongful act or infringement of a right other than under contract leading to a civil legal liability. All those things we just talked about, by the way, guys, are example of torts. Also called intentional misconducts. A tort is the same as an intentional misconduct. By the way, fraud's one we didn't talk about. What's fraud?
Like writing bad checks.
You being
No, that's called
Rights checks anymore.
You should, I'm saying because you need to know the difference between defamation and fraud. Defamation is written falsehoods to hurt somebody, or using confidential info that's written to ruin someone's life, whereas fraud would be what?
Oh, they get advantage.
Spoken like, it's almost like the spoken version of defamation. I'm speaking it out, speaking falsehoods to mess someone's life up. Like I'm up here talking about, like y'all said I was a CT fraud. I'm talking about CT, but I haven't actually done it, so y'all said Mr. Donahue was a CT fraud.
Yeah,
That really hurts, you know.
Jeez.
Such a nasty word. Such a nasty word.
It's okay. I know there was 2 types of defamation.
There is. Well, not 2 types, 2 ways of saying the same thing.
Spoken.
So, overlap once again. Overlap. Basically, I forget what was the other word. Defamation
It's like
and
slander or
Yes.
slander.
Legal?
Slander, slander.
Slander and
Slander is
Legal.
when you speak.
slander, fraud. Yeah,
Oh,
So
libel.
slander is the same
Libel?
as fraud?
a lot of overlap there.
That's written.
Mhm. Which we didn't go over those, but that's a good. Those are good to remember as well. So going back to this again, guys, because of all the torts that we've gone over, these are the 2 most important that you're going to see used the most on critical thinking questions. So assault and battery, related but different. Once again, assault is when a person commits an act that puts a victim in reasonable apprehension of harmful or offensive contact. That's a fancy way of saying you're threatening vocally. Once again, battery is when you actually commit said act and actually inflict harm or offensive contact on the victim. It can be something simple as a push, a tickle, a pat on the back, or a punch in the face. All forms of actual battery because you're making physical contact. Whereas assault is the initial threat, verbalization. Assault occurs when a person commits an act that may inflict physical harm on someone else. Battery takes place when a person actually commits the act that does inflict physical harm on another. You'll see the difference there? And I'm giving you these different definitions because these are ways it might be worded differently on your exams, but all meaning the same thing. Yes?
To go a little bit deeper, does intentionality like actually matter in this case? Like, let's say they have a pin in their finger and you're trying to position their whatever, but like your glove gets caught on their pin, or like it's not like you tried to do that. You're trying to help them, but
So here's where something like that would fall. They can accuse you of battery, but that's the power of your documentation coming into play as well, where you're making documentation of what actually happened to defend yourself. So anyone can accuse you of battery, but you can always defend against that as well, which is why I always tell you guys there's power in documentation in everything you do.
So just note it, even if it's
Note everything you do, because these days, especially guys, people will sue at the drop of a hat. You so much as sneeze wrong, someone gets offended by it, and they'll try to sue you. So you got to be really careful with what you're doing, and make sure you're always covering your tracks. Make sure there's a paper trail in everything you do, just in case.
Can we get a break? Go back one.
Y'all need a break? We can do a break. What time is it?
10:05.
Oh, yeah, it is time for a break. Take a break, guys. 15 minutes. Come back at 10:20.
10:05.